Hi, my name is Deanna Hill, and I'd like to take this time to talk to you about my philosophy on nursing and healthcare. It's been a while since anybody's asked me what my philosophy on nursing is, and I found this assignment a bit challenging, I guess. I know my actions reflect my philosophy, but at least I think they do, but it was kind of hard for me to put into words like what my philosophy is. But I think I got it. I feel like my philosophy on nursing has evolved over time, but the foundations that I base my philosophy on has not changed. Caring, generosity, accountability, respect, excellence, and independence are attributes I value. When I first started the ICU, I was like a year out of nursing school, and it was such a big learning curve for me. I remember driving into work like an hour early all the time, just because I was so nervous, um, and I was so nervous before my shift, and I would pray. I would pray, on my drive to work, and that seemed to like ease my nervousness. And of course, I had a long list of things I asked. I asked for guidance, and I asked for, everything and anything that I needed to do during a night shift in the ICU. And I did this for a couple of years. I did this for a long time. And then I think once I got comfortable with being an ICU nurse, I still prayed, but I find myself kind of like losing track of what I was thinking. And then by the time I got to the hospital, it was like, oh, wait, I forgot to ask for this, or I forgot to ask for that. So one day I just wrote down, like, what if I had to ask for guidance from God to be a good nurse? Like, what would they be? And I came up with a few what to ask him. So so now, like, when I say prayer or whatever, I always ask for God to help me provide care that is efficient and effective, and to be a strong patient advocate. And I think. I guess that's my philosophy on nursing, is to provide efficient and effective care and to be a strong patient advocate. My philosophy on healthcare, as an ICU nurse, again, like, I feel like my experience with healthcare is so limited. As an ICU nurse, you only see patients. I only have a snapshot of a patient's health, and it's usually at their worst. A few years ago, I had the opportunity to work down in the ER at the VA, and I worked there for a couple months, and it was quite it was quite an eye-opening experience for me. Many times people came to the ER. They came to the ER for like everything. It could be like, medication refill for like narcotics, or hypertension medication, diabetes medication, whatever. People came because they had abdominal pain, they thought they were having an MI, anxiety, they had suicidal ideations, everything. And sometimes I would ask them, like, why, why, why didn't you call your doctor's office? Like, why are you here in the ER? And the response was always the same. I called the office, they never called back, or I called the office and they said the most latest or earliest appointment they would have would be like 4 or 5 days. So they just decided, oh, let's just go to the ER. And it was kind of like their safety net, I guess. My time in the ER taught me that we do have a need for primary care providers. I think if we had more primary care providers, it would declog the system, and people would go to the ER only to, or only in emergency cases. In this respect, I feel like people should have access to health care. I don't know if it's a right or a right or a privilege, but I feel like it's financially, it seems like financially it's a good investment. If people have primary care providers and they don't utilize the ER a lot, then that saves society a lot of money. And maybe we can use those funds to educate people on on other health care, on other things. Thanks for your time. Bye. Okay, turn it off.
How do I stop it?
Did it stop?
No?
Oh, it's